6:30 now. It's the Adult Social Care and Health Select Committee. It's Thursday, 22nd of October, 2020. Members of the committee, please turn on your camera and confirm your audio is working before we go live. Yeah, so we are all able to record and hear each other.
Yeah.
Yep. Thank you. Now, good evening, and I welcome you all to this meeting of the Adult Social Care and Health Select Committee. I am Councillor Marwan El-Naji, the Select Committee Chair. This meeting is being held in accordance with the recent government regulation on virtual meetings. Please bear with us if we run into any technical challenges or difficulties during this meeting. In line with government guidance that everyone should stay at home as much as possible, this meeting is being held via Microsoft Teams live conferencing, and all the committee members, council members, and the parties who wish to participate in this meeting are joining from remote locations. The event is also being streamed live, and members of the public and the media are welcome to follow the meeting remotely and listen to the discussion that's taking place. I would like to welcome any first-time viewers or listeners to this Adult Social Care and Health Select Committee. Now, as in all our meetings, I think it will be only appropriate if for us to start our official meeting with a 72-second silence to remember those who lost their lives in the Grenfell Tower fires tragedy. Gareth, it's over to you to start, please.
Yes, I'm starting the silence now.
Thank you.
The 72 seconds has elapsed.
Gareth or Tom, I think there's something wrong with the slides for the meeting. I can't see them. Sorry.
Okay, sorry about this one, Councillor Rossi. Gareth, can you?
I can see them.
I see. All right. So we can address that issue. Now, at the outset, I would like to ask all members of the committee only to unmute their microphone when they are addressing the meeting. Likewise, to save bandwidth, I would like to ask all councillors only to switch on their cameras, if possible, or to try to see any problem, only when they try to speak, and then switch them off when they stop speaking. If a councillor wishes to speak on a particular item and has not been called to speak, please indicate by typing the letter Q in the conversation column, and or by using their hands up feature, if possible and available, or drawing my attention verbally using the microphone. Please do not use the conversation column for other comments, as they can be seen by all participants and they are retained for our record. To assist your fellow councillors, officers, and members of the public watching our recording online, please state your name before you speak. If for any reason your connection drops out or you miss something, please can you let us know? In the event that my connection drops and I cannot continue this meeting, I will nominate my vice chair, Councillor Max Chauhan, to take over the meeting, and he has a full agenda. In starting, I confirm that I have no declaration of interest to make regarding any items on this agenda. I will now turn on to my committee members. So please, could the members also let us know if you have any declaration to make after introducing yourself. So may I call upon Councillor Max Chauhan.
Hello.
Councillor Chauhan?
Hello. Can you hear me?
Yes, declaration of interest, please.
No declaration of interests besides working as an honorary consultant in Imperial College.
Okay, thank you so much, Councillor Chauhan. Councillor Idris?
Good evening, everyone. Councillor Idris,
Councillor Idris?
Yeah, good evening, everyone. I'm Councillor Idris, Brompton and Handstown, and I have nothing to declare. Thank you.
Thank you, Councillor. Councillor Faxter?
Councillor Faxter, St Helens Ward.
Councillor Faxter,
employee of CNWL.
No. And Councillor Williams?
Councillor Charles Williams, I have no interest to declare, but I've mentioned that I am the council's representative on the governing body of CNWL.
Thank you, Councillor. Councillor Williams? Thank you. And may I call on our team members, Christine Vigars?
Christine Vigas from Health Watch Central West London, and I sit as Health Watch representative on the Joint Committee of CCGs for North West London.
Okay. I can now move on
Chairman,
to
Councillor,
item A1 on the
Chairman,
agenda.
if I may.
Apologies for absence.
Chairman, if I may, it's Councillor Malcolm
We
Spalding.
received one apology, I believe, from Councillor Laura Ramos.
I have no interest to declare.
Thank you so much, Ms. Vigars. Okay, now I move on to item A1. The voice is not clear. Councillor Spalding?
Chairman, Councillor Malcolm Spalding, Earls Court Ward. I have no interest to declare, but at the end of the meeting, I want to mention an item which is specific to my ward, with your permission.
Is there a problem?
I think the chair may have lost connection.
I think, yeah, he dropped off. Shall we call him?
Yeah, I'm just going to pause the live stream for a second while we try and get the chair back into the room. So. we're live again now. Thank you.
Thank you, Tom. Apologies for Councillor Enalge, who has got technical difficulties at the moment and is not able to attend the meeting at this moment. But I will take over at agenda item A4, the West London CCG and COVID-19 recovery update. So this recovery plan describes the key out-of-hospital priorities across West London CCG area. These priorities reflect the need to deliver services that are specific to new or additional needs resulting from the COVID-19 pandemic. That is as a result of illness, isolation, etc. So I just want to invite Andrew Steed, Chair of West London CCG, to present the report. Thank you.
So I must apologise because I wasn't expecting to present this. I thought Louise or Jane Wheeler was going to do that, but they are having difficulty signing in. So I'm not really able to take you through the report, but I'm very happy if people have read the report to take any questions on it. And those things I can't answer, I'll get Louise and Jane to come back to us. I do apologise. I've been trying to contact them and they're trying to get in as I speak, but I'm very happy to take any questions on the report.
Okay, so I'll take that. Well, then we'll have to take the report as read, and if any members,
I have a question, Chair, if I may.
Please, yes, Councillor Idris.
Thank you. My first question is, I want to ask about the continued support. I understand with COVID, a lot of patients missed out on regular appointments or appointment that has been already set up. So how caught up are we now, or how behind are we? Either or.
Are we talking about outpatient appointments?
Yes.
Okay, so we are trying very hard to catch up. We have been working with the major providers, Chelsea and Westminster, Imperial, and the other hospitals to try and review the waiting list. There's been a process of prioritising people on the waiting list to try and get those who are more acutely well or might have conditions that are more dangerous to be seen first. So there's a prioritisation process that's been going on. But there has been an increase in the waiting list. We are currently seeing an increase in over 52-week waits for some outpatient procedures, and that's being targeted by the recovery programme to try and reduce that and identify patients who are waiting more than 52 weeks as well. I think compared to the rest of London, we're doing slightly better than the rest of London, but that it is an enormous task which but people are focusing on now. In an attempt to stop the list from increasing, there are various schemes in place to access advice and guidance so that primary care and patients can be supported in the management of their conditions without having to go onto this enormous waiting list. So there's various schemes in place to bypass the waiting list so that patients can get access to care and advice in a much quicker way. But the waiting list is increasing, I'm afraid.
So if you can quantify for me how much we were before and how how many people are lagging behind now so just to get my head around the figures, because I know there's going to be a lag, and I know we're probably trying to do everything to counter that. However, my concern is the quantity, because we're in London, and London keeps moving back into a semi-demi lockdown, and as that continues, I think it will affect a lot of old and existing and new GP appointments, hospital appointments. So if you just quantify it for me, so I can just, in my head, I'm a little bit clearer.
Yeah, so I don't have the figures for RBKC. The figures for across Northwest London, I think, are about. I think they're in the ballpark of about 1,000 patients being added to the waiting list a week. Sorry. But I don't have the exact figures for West London, but I can try and make sure that we forward them to you. Because of the lockdown and the closure of normal hospital services during the first COVID spike, there is a real attempt to keep business as usual going, outpatients, diagnostics and operating procedures, to keep them going and to keep hospitals open for as long as possible during the winter period. So there isn't an expectation, even if we go into tier 2 or further COVID spike, that we'll have the same close down as we had with the first spike. So hopefully we're dealing with the worst of any backlog now, and we should be addressing it going forward.
Okay. Thank you very much.
But we do have weekly figures on this, so if you're interested, we can share with you the weekly figures that we get. There's a meeting every Friday lunchtime on this where we review the figures every week.
Okay, that'd be great. Thank you very much. Thank you, Chair. Thank you.
Idris, I've got two more questions, and I think Marwan will be returning at agenda item 5, I believe. So I'll just take the next question from Christine Viggers. Christine? Christine's hands up.
Yeah, sorry.
Yeah.
Following on from that, could you update us on what the situation is on diagnostic tests? I mean, are GPs able to get the diagnostic tests that they need, including blood tests, or is that also a problem at the moment?
No, so blood tests are normal. GPs are able to access blood tests as normal. Most diagnostics are open as normal again. There are various diagnostics which are still having some difficulty because of numbers. Some of those is endoscopy, and endoscopy has a very particular plan around how to catch up on the backlog with endoscopy. In fact, Northwest London is leading on this as a project for the rest of England and Wales. The other area that's caused some delay, backlog is access to ultrasound. Now the access is there. What's been agreed over the last few weeks are the thresholds and the guidelines for using that in primary care. But all diagnostics are now open again in primary care, so GPs should be able to access them.
Thank you. Then my other question is about people's willingness to actually go to their GP and to attend hospital. Are you finding that there is a sense that people don't want to come forward for tests or don't want to go to hospital? Because this was something we were picking up, I think, from Imperial when we went to see them, that even when a hospital appointment was offered, people were reluctant to go. And if so, is there anything we can do about that? Yeah,
so you're absolutely right. So we're finding that I think in some parts of Northwest London, as many as 30% of those invited to come in, either for a diagnostic, but perhaps more importantly for an operation, are not turning up or refusing to come in because of their fears of coming into a health establishment. I think the most important thing we can do is reassure people how seriously the NHS is taking infection control, that the precautions and the procedures that we put in place before someone can access either a diagnostic setting or a treatment setting should be keeping both the patient, their family and the staff safe. So this is something we're monitoring all the time, but I think it's about getting the message out there that it's safe to go into hospitals, whether that's for an investigation or a procedure.
Thank you.
And thank you very much. Any further questions, Christine? So we move on to Councillor Williams, who has a question.
Yes, thank you. My concern was about mental health services delivered at primary level, and some people the COVID situation has added to stress, and with this emphasis on virtual first, I mean, are people still going to be able to see their GP very readily if they feel they need advice for these sorts of situations?
Yeah, so the GPs across North West London and West London too are following the national guidance around triaging patients to the most appropriate care setting, which still includes face-to-face consultations if there's value in doing that, both for the patient and for the doctor. So they should be able to access face-to-face if it's felt that it's required. But I must say, but increasingly, patients are reporting back that they're reasonably content with both phone contact and video contact as well. It's not ideal for everybody, but what we are seeing is that actually, because they're able to get access to a GP on the same day now, which wasn't always possible pre-COVID, people do appreciate the same day access. But we're never going to get rid of the face-to-face consultations, and we don't want to. So anyone who needs them should be able to access those.
Thank you very much.
Councillor Spalding Councillor Spalding has his hand up, as does Councillor Atkinson and Idris. So let's start with Councillor Spalding.
Thank you, Chairman. Two questions. The first question relates to the last page of the report, which is the local RBKC response. The bullet point in the first column, 6, local testing capability established for staff and patients. I just wanted to ask, related to that, 2 points. Presumably that's a target of 100% of GP and hospital staff. Do we know, has that been achieved? And secondly, when you say a testing capability for patients, does that mean all patients entering hospital? And is that 100%?
So, Councillor, I don't know the answer to that in detail. I can get that answer for you. I certainly know that not all GPs have been tested because they haven't required it. As far as I'm aware, all healthcare professionals in West London RBKC that require it for whatever reason, and their families, do have access to that. And as the last time I was briefed, that was working quite well. I know that the capacity for patients going into hospital is fully utilised as well. There is some spare capacity in the hospitals, and they've been using that to help support us in the community too. So I have every reason to think, without the figures in front of me, that we are hitting 100%, yeah, for those that are required.
If we could get later on some figures.
Yeah,
then leads to the second quick question. The councillor's got an email this afternoon from governance to say that we're now going to do a risk assessment on staff and councillors who may be doing site visits, or councillors who may wish to visit the town hall, where the town hall is declared a COVID secure area. And I just wondered if anybody's aware that testing will be available for council staff and for councillors, and if not, to mark that question at this meeting in the hope that governance can come back to us and explain what the risk assessments will involve and how many councillors and staff will be able to access COVID testing.
Okay.
Thank you.
Thank you.
Thank you, Councillor Spalding. We have a question from a councillor who's not on the committee. Councillor Robert Atkinson, please.
Thank you, Acting Chair. I have a question about the role of St Charles Hospital in what has been happening. I note in the report there's a reference to adding 31 surge community beds to a core stock of 155. Can I ask, are those beds at St Charles? Because I'm not clear what has been happening at St Charles, because certainly my constituents are very concerned that the minor injuries unit at St Charles has been closed for 7 months. And when I first went to inquire about it, there was a notice on the door saying this was a temporary measure, not really much help or information given to local residents. And I had reason myself to attend an outpatient clinic at St Charles last week, which I've got to say went absolutely brilliantly. But the place seemed to be fully staffed with people on reception, with porters, people working in the shops, but there was nobody there apart from the staff. Now, I recognise if you've closed something down for a while, it takes time to get things back. But what has been happening at St Charles, and what is happening now, please?
Yeah, so we've got various things happening at St Charles. We've got the Escalated Care Clinic, which is manned at St Charles. This is the clinic that we use for patients who are potentially COVID positive and need a face-to-face consultation somewhere other than their home. So that's there every 7 days a week. There are the surge beds, I think, are the beds that we're using in the Pembridge unit to support the community beds requirements that we might need. There are booked appointments at the urgent care centres that we're opening up as well soon. So there's telephone triage happening at St Charles. There's also, of course, the primary care units at St Charles, which are open still too, presumably doing, well, I know they're doing face-to-face as well as triage and video consultations too.
So can I ask, does that mean that my experience of it being staffed but nobody there is intentional and is a good thing, because you're keeping unnecessary people out of the area, but actually the hospital is functioning as best as it can and being used to full capacity, and it was just that the non-necessary people have been very effectively kept out.
Yeah, that's my reading of the situation and my experience, because I work up there at the Escalated Care Clinic as well. So that's my experience there too. That we've got a risk stratified staff workforce there who are doing more things than we would have previously had to do, cleaning rooms, directing patients, and other things. So yeah, so I think we do have less kind of casual footfall through St Charles than we've had before, but still the essential face-to-face stuff.
Well, I mean, can I just find this? I mean, I'm pleased and to an extent reassured by that. I still go back to the basic point that the facility for minor injuries, which was previously available and much valued by people in the area, to take it away for 8 months, well, I suppose is disastrous, and perhaps you will say that absolutely has been necessary because of the gravity of the situation.
Well, I think it was initially, I mean, certainly there was a view that we needed to manage patients' access to healthcare services so that we could protect staff and protect patients. So all walk-in facilities, the appropriateness and the infection control policy of all walk-in facilities has been reviewed. My understanding from the beginning was that actually the numbers of people using the minor care service had dropped enormously during the first spike, that it was just not worth keeping open. Staff just didn't have anything to do. But I'm sure we're going to give you an update on the plans for opening it up in a bookable way going forward to support the winter pressures.
Thanks very much.
No problem.
Thank you, Councillor Atkinson. I have somebody called Dominic Condon who's got the suffix of CWFT. If you could just explain what the acronym means and
yes,
thank you.
Thank you, Chair. I'm Dominic Condon. I'm Hospital Director at Chelsea Westminster Foundation Trust. I wasn't sure how many texts I'd have to put in the field, so my apologies. I just wanted to supplement some of the points Andrew was making about the recovery process and pick up on some of the points of detail that other councillors raised to try and be helpful. Just starting with St Charles, just to add there, they've been very generous. We have been able to use St Charles outpatient areas to undertake our pre-operation assessments. Councillors may know that nationally and London have issued guidance about best practice for protected elective pathways, and carrying out tests off-site before they come on-site is one of the best practice features which, due to the use of St Charles, we've been able to do. So all of our surgical patients 72 hours before operation are using the St Charles facilities to be swabbed in the testing. Similarly, on that testing criteria, as Andrew said, we have a little bit of spare capacity in ours. We've started a testing program for staff and patients, obviously, and we've been supporting care homes, those who can't access the pillar 2, obviously a very particularly vulnerable group of the population. So I just thought that councillors would like to know about that piece of work. And then finally, there's a question about the backlogs. Obviously, we're working through those. I don't have the borough statistics, but we can certainly supplement the work that Andrew and his team are doing and give you some illustrations of the type of progress we're making to capture on the backlog with a specific issue about our local providers. And then finally, at the risk of talking too much, if it's helpful, our main focus at the moment is on a second surge and establishing additional critical care capacity. And some councillors will know that we actually put some of our capital programme into redeveloping one of our wards at Chelsea and Westminster. And so we are now able to surge all the way up to 32 critical care beds for local patients in the event of the second phase.
Thanks.
I'll stop there.
Thank you.
Thank you. Are there, I think Robert Atkinson has his hand up still. Is there a new question, Robert? Or Councillor Atkinson, I should say?
Sorry. No, it's a mistake. I'll take it down.
Thank you. So I think that's all of the questions so far. Do we have any more questions? Okay, so what I would like to ask now are the committee members if they agree with the recommendation in paragraph 2.1 of the report on page 1. So 2.1, do we support the whole system response to the pandemic with strong and close working between RBKC, the NHS and our communities?
Agreed, Chairman.
Agreed, yes.
Thank you.
Agreed. Agreed, Chairman.
Thank you very much. So it's been quite a healthy discussion on the primary care resilience and diagnostic services and the people's reluctance to attend hospital. And Andrew stated that there's a 30% reduction in Northwest London, people actually failing to attend diagnostic appointments or operations even. He stressed that it is safe to go into hospitals. And we discussed mental health services, and people are readily going to see GPs, and we discussed patients are content in accessing GP via phone or video. In fact, access is improving, in timely access is improving with these methods of getting GP appointments. Malcolm also asked about, Councillor Spalding also asked about the local RBKC response and the figures and requested figures on the local RBKC response, and I think that will be provided at some point from Andrew. And the role of St Charles Hospital was highlighted, and the beds and the fact that it was closed for 7 months. So in kind of general summary, that's what we discussed, and I'm going to now hopefully hand over back to Councillor Nalgi. Is he with us?
I hope it's working this time.
Yes.
Hello. Hi. Can you hear me, Max?
Yes.
Yes, we can hear you. We can chat.
Thank you so much, Councillor Shahan, for taking over at this critical time.
My pleasure.
Councillor Aziz, can you hear me? Somebody can
Yes,
confirm
yes, yes, we can hear you.
Okay.
And see you.
Oh, super. Thanks. I just need confirmation from what. Okay, thank you so much. One other thing is to add regarding to St. Charles, thanks, Councillor Shahan, for rescuing on a technical failure here, and I managed to listen to the last part of the discussion summary, but definitely I will listen to it in details. I've just received this afternoon from Jane Wheeler, the Associate Director for Integrated Care and Mental Health, that the Urgent Care Center at St. Charles Hospital will be functioning from Monday, the 26th of October. So that's welcoming news for us. Thank you so much. I would like, somebody want to come in? Kathleen, can you?
Hi, yes, my name's Kathleen Isaac. I'm the Deputy Director of Operations for CLCH, and I just wanted to add to the information about St. Charles Urgent Care Centre opening on Monday. We are opening it on Monday as a pre-booked appointment to make sure that we can follow the infection prevention guidance and maintain patient safety, so that's why it won't be walk-in. So I just wanted to make that point, and that's why it won't just be a walk-in, people will have pre-bookable appointments. Thank you.
Thank you. That's very welcoming. Now, to continue with our agenda, I will move on quite ahead of our time to agenda A5, COVID-19 and social care. It's an update from our lead member, the Councillor Addenbrook. I hope all my committee members and everyone listening have managed to have a look at the report. If I will leave it to Councillor Addenbrook if she wants to just give an overall view about the report, then we'll go into questions. So may I call into Councillor Addenbrook to present her report and the way she wants. If she wants to go straight to questions, I will welcome that from the committee as well.
Thank you, Chair.
I call Councillor Addenbrook, please, if she's with us.
I am. I think as it's quite a detailed report, I'm assuming that everybody will have read it. So, I mean, I'm happy just to go to questions, or if anybody's got anything in particular they want to ask.
All right. So, thank you. As you can see, this report is quite try to address the different challenges. So may I ask our members if you have any questions, the committee members, please. You want to ask questions? So I will start with Councillor Williams, then Councillor Idris, then Ms. Vigards.
Thank you. Yes, I would like to ask about paragraph 7.2, the Health and Wellbeing Survey for North Kensington. Could somebody explain a little, just briefly, how it's conducted, and confirm that we will get the results in January?
So it would have been done with people knocking on doors, but obviously that's not possible. So it's going to be done remotely we may, I think, employ a company to actually do the calling for us, because it's we hope to reach as many people as we can, but it's going to be difficult. It's not going to be an easy one.
Thank you.
So I am hoping actually that we will get the results in January.
Thank you.
Thank you, Councillor. Councillor Idris?
Thank you, Chair. My question is about point 9, all the winter planning. I just want to know how we look ready, but I just want to hear it. How ready are we for the winter, and especially considering there is a backlog from the spring and the summer with all the COVID restrictions. So I'm again is more or less is following my earlier question, is how ready are we, and how ready are our GPs, every surgery, that type of thing, for the influx of winter problems? Thank you.
So I think the first thing I'd like to say is, could everybody please go and get their flu vaccination? That will help with winter planning. I mean, we're working very closely with the CCG and with the GPs, with the hospitals on hospital discharge. I mean, it's going to be very difficult, I think. And maybe, I mean, Chanel, do you have anything to add? I've lost Chanel.
Chanel, I don't think she is here, is she?
She was.
I am so sorry.
Right.
I was on mute. Good evening, everyone.
Yes.
I'm Chanel Arkut. I'm the Director of Health Partnerships in Adult Social Care. We have a really robust winter plan. And this year, we actually were given directions from NHS England on how our winter plan should address. The responsibilities were very clearly given to us. This is the first time that we had this winter plan from NHS. But our plan is aligned to the system winter plan. We have presented the plan to both A&E boards in Chel West and in Imperial, and it was received very positively. We have used our winter funding to improve the number of frontline social workers, improve provision in terms of home care, reablement. We improved the number of OTs in the frontline to make sure that our residents' needs are met, and we follow them after hospital discharge in the community, and their equipment and environment is safe for them to remain. But as Councillor Adam Brooks said, we are going to face a tough winter ahead. We have the second wave, as well as the usual winter pressures. Therefore, it is going to be a tough few months ahead.
Thank you.
Thank you very much. Thank you.
Councillor Idris, do you want to recap on that? I can see still your hands up. Or
no.
Go to
no,
another question. Councillor Idris. Okay, so we go to the next question from Ms. Vigars, please. Ms. Vigars, you are muted. Yes.
Okay.
You are muted.
Two questions.
Go with your question, please.
The first one is about care homes. Do you have any information about how far care homes have been able to keep up contact between their residents and their families and loved ones, despite the lack of visiting? And are there any plans on that going forward? That's one. And the other one is around shielding. First of all, really to say that there was a lot of appreciation about the work that the council put into the shielding programme in the first wave. But as we go forward, there is a core group of people who are still shielding because of their conditions, and what support is going to be available for them as we move into the next stage.
Okay, so with care homes, I mean, I think everybody knows that we originally supplied all the care homes with iPads so that they could stay in contact with their families. When the restrictions were eased, families were able, one member of each family was able to visit outside in the gardens. That has ceased again, and we are looking at what we can do if there's some way that we can, that the families could be given PPE testing and visit the residents. But that's a work in progress, I'm afraid, because everybody appreciates how difficult it is for both the residents and the families not being able to see each other.
Thank you.
And then on the shielding, I know that I'm not quite so sure because that comes under communities, but they are certainly looking at what is going to be provided. But I would have to check and get back to you on that because I'm not actually sure where we've got to on that.
Thank you.
Thank you, Councillor Edinburgh. Thanks for a very good question from Ms. Vigars. It's quite a stressful time for people living in care homes and the compounded by loneliness in its own right. So I can go now to Councillor Chauhan, please, and then Councillor Healy after. Councillor Chauhan, please, what's your question?
Thank you. My question is on section paragraph 5.4 on page 4 on the sufficiency of primary and community services. I believe North West London CCG carried out early modelling on the demand of acute beds. That's quite important at this time of year, especially from October through to January, that we are going to get a peak anyway of the normal winter pressures. But the CCG's modelling showed they've identified key peak periods. Do we know when they are, besides the general trend of increasing winter pressure peaks?
I haven't actually seen that. Chanel, have you seen it?
Yeah.
I'm afraid I haven't seen that either, but we're happy to get you that information, Councillor.
It'd be very helpful. Yes, thank you. Thank you.
Can I help with that?
Yes,
so
please.
We can come back with this data. Yeah. You want to follow on? Okay.
So I think Andrew might be able to help us on that one.
Andrew, please. Yeah.
Yeah. So we there is, as you can imagine, there's regular modelling around the bed capacity in North West London. I think the first modelling suggested that we might be running into problem with beds towards the end of November, but that has been updated now, and we're now doing modelling that's based on about 3 weeks advance, because any modelling beyond 3 weeks is thought not to be reliable. So I don't think at the moment we are modelling to run out of beds at any stage, if that's what the question was. But clearly that might change as
yeah, I mean, when we run out of capacity. Yeah.
And that was the kind of thrust of the question. I mean, having said that, I guess the Nightingales are on standby for respiratory related demands.
So there's a lot of confidence that we'll be able to manage things in-house in North West London.
Thank you very much. Yeah, I think I agree with that.
Thank you. Thank you, Andrew, for clarification there. Councillor Healy, please, with your question.
Thank you, Chair. I'd like to reassure Councillor Addenbrooke that I've had my flu jab, and I've also this very day received from the Council the latest guidance to people who have been shielded, so that is working. I'd like to ask a couple of questions on, first of all, on section 6, the workforce strategy in light of the pandemic. The last bullet point says that part of the money that's available for this is providing accommodation the staff who proactively choose to stay separately from their families in order to limit social interaction outside work. Do we have any idea whether this is entirely care home staff or whether it's wider than that? How many have taken this up and for how long? If you'd like to answer that question first, I've got another one afterwards.
I think we would have to get back to you if, with the numbers, because I don't have that information, unless anybody, any of the officers do.
Hello, Councillor Allenbrook. It's Gareth, Director of Integrated Commissioning. We don't have those direct numbers. We have made the infection control funding available to all care homes and to our contracted care home care providers for that purpose. They don't return data to us in terms of specific numbers, but just to confirm that they have spent it on a number of criteria which include that one. But we can ask and see if we can get some specific numbers for you.
Okay, that would be helpful. My second question is also about numbers. It's paragraph 8, statistics on COVID. There are some statistics there about overall numbers, but there's nothing there about how many deaths there have been, what kind of ages people have had, whether they've had other health issues, or indeed whether they're from BAME communities. Is it possible to have that kind of detailed information, please?
I'll have to check with Public Health, but of the registered deaths in Kensington and Chelsea, not all those deaths are residents. So
right. Okay.
We don't tend to give out the numbers because it's not, I mean, we're below the London average.
Yeah.
We might be able to get you some additional information, but certainly, I mean, if you look at paragraph 8.5, it says of the residents who have died from COVID-19 and had their deaths registered in RBKC, 88% had an underlying health condition.
Yes, indeed. Okay, thank you.
Thank you, Councillor Healy, for this interesting insight. Anyone else before I open it to from the public? Councillor Healy, do you want to follow up on this or just finish?
No, sorry.
Okay, no problem. Councillor Shohan, do you want to follow up on this question, on this issue?
Well, I just have a kind of question on workforce strategy as well.
Yes.
And that's on page 5 and paragraph 6.2. We've trained many staff for redeployment and who are in the kind of reserve to be redeployed. Do we have an idea of how many staff have been trained and how are they kind of located? Are they on a bank system within, and which bank system they are? Are they on, if they are on a bank system?
Again, I don't have the numbers. I don't know whether Gareth has those.
Not specifically for people who may have been trained for social care roles. We know that we didn't use them in those instances because none of the staffing amongst our care providers dropped below 80% at any point during the pandemic so far. So we haven't had to do that across the whole piece of different services where staff were redeployed. That was about 100 roles in total, but that was for all sorts of different things across the council. But we didn't use any specifically for care work.
Okay, and they're easily kind of accessible. They're on some kind of database and on a bank system and ready to go.
Yes, and in fact, that's been kind of carefully monitored for preparations for potential needs for redeployment again over the next wave.
That's great. Thank you very much, Gareth.
Okay. Yeah, I mean the staff members at the moment. Of course, I mean, they're staying away with this high rise in tiers 2 problem. We are on high risk. I mean, if I would like to ask this question. I mean, now we are not, of course, encouraging people to come in because the restriction is higher. And are we expecting it to be to go if there is a compounded effect with the harsh winter in 3 weeks, 4 weeks time. And you said that in 3 weeks it's very hard to predict in terms of modeling. But is there any contingency in place? And you can direct us to it as in our strategy?
I'm sorry, I'm not quite sure I understand what you're asking.
Is if we have, do we have like a further contingency plan? If we have we move into a higher tier like Manchester?
Yeah, so I mean, I think, you know, there's a lot of planning going on at the moment. We learnt an awful lot from the first wave. So staff are being redeployed into communities. There's the hub, there's all the work that's going on there. So there's a lot of work going on. And yes, I think we will be ready.
Okay. All right. So
and just on that, so we have Moulton Road testing now. We're also looking for a site in Chelsea, which I'm not quite sure when it's going to be confirmed. I hope it's going to be soon. There's also a mobile testing unit today and tomorrow at the town hall. And if we see more cases in certain areas, then we certainly ask for another mobile testing unit.
Okay. And with that, Moulton, which I welcome, it's nicely operational. I passed by it recently. It's quite good, calm. So we'll rely on that data for increasing our mobility, reaching out those who cannot register online. Is that included in our work?
So at the moment, you should book a test.
Yes.
We are in regular correspondence with the Department of Health and Social Care, asking if we can have walk-in testing. I don't believe we've got that agreement as of yet, but we are asking for that because I think it would mean our residents are going there rather than anybody who registers from Hammersmith and Fulham or Wandsworth or wherever.
Yeah, so we are pursuing that, Councillor Addenbrooke, yeah?
Yeah.
Okay, thank you so much for this reassurance. Anybody else want to ask any question on the report or on the strategy? And no one. I can't see anyone at the moment putting their hand up, or for any reason they can call me. If so, I can call this session to an end. Councillor Addenbrooke, thank you so much for sharing your work with us, with the officers as well, supporting our questions on this. So, thank you.
Thank you.
Marwan, it's Marie-Therese here. Just to mention, we haven't done the minutes yet, A3, for the previous meeting.
I think I asked no response when for the minutes on
okay, all right, sorry.
July.
Okay, sorry for interfering. Sorry.
No problem, Councillor Rossi. But I asked earlier and no one expressed any questions or any amendments. So I called the minutes carried.
Okay, fine. Sorry. Okay, bye.
Yeah, no, thank you for the clarification. So to conclude this item, I can summarize that, I mean, there is quite a lively debate here happened with various questions on health and well-being in North Kensington, how it's being addressed, how we are going to deal with the winter planning if we see any surge, and hopefully we get an answer that yes, we are ready for that. And there is a clear encouragement from the lead member for the campaign for flu vaccination, because this will help. And we have the first time to have family NHS, where is a positive response and engagement with Imperial Health. And this is following into the community. And we are expecting, so at least we have this expectation that it could be a tough winter ahead of us, combining with the COVID. We don't know. As long as we keep it under control, following the guidance, hopefully the winter will pass with ease. There is a very interesting question regarding care home and how to keep in constant contact with the family. And it's very interesting to see that the council providing all care homes with iPads, computer facility where you are to keep in contact with loved ones. So this element of isolation is really a key factor in the healing for future in coping with COVID, because if you have any sense of it, you have to isolate yourself for 2 weeks. And we have how to deal with the backlog and over a peak period. And we have the response on how we are dealing with the modeling techniques to predict any future planning. And there is a problem predicting beyond 3 weeks time. And to conclude, there are some questions regarding section 6.1 and 6.2, where the not enough statistics available. I think we need to move into that domain of data focus, so we can really read more from the data, especially regarding deaths when it is occurring. Can be confusing the statistics. And we had one section which is clarifying that those who are not living in the borough, I believe there are not who are not residents. That's been clarified because we have a very large student population living in the borough. And then we have the finally on the workforce strategy and how we are dealing with our staff in this time of crisis. So now we move on to a very important section 8.6 regarding the work program for our select committee. And this is the final item on our agenda for tonight. So I will call on Jackie Hurd. She is our scrutiny manager, to introduce the brief introduction to this item, if she may, please.
Thank you, Chair. So contained in the report on the agenda is the proposed work programme for the committee. So that was developed following consultation with councillors, residents, partner agencies, and there was a detailed workshop with councillors where they discussed the suggestions and what they wanted to put forward. So that was agreed at the overview committee on the 24th of September. And then it's come here for your more detailed discussion. So the report sets out the topics, COVID-19 and adult social care and health, which you've discussed tonight, but may wish to discuss at future meetings because of the current situation. The other topics were adult safeguarding, mental health in North Kensington, and primary care access and provision. There are two reserve items, immunisation and NHS complaints, so the committee would want to consider their capacity to take those on. But the purpose of this item is for the committee to discuss the suggested methodology that's in the report and which members of the committee would like to be involved in developing the topics. Thank you. I'll just hand it back to you, Chair. Thank you.
Okay. Over to me. Thank you so much, Jackie, for introducing this. So now, as you can see, this is the from the topics we decided. If I move on, because the safeguarding in vulnerable adults, it's statutory requirements there. I would like to move on to the second topic on mental health in North Kensington. The proposal is that we review this issue by setting up a working group to examine the topic in depth, because my concern is which is compounding the issue of COVID, the trauma our North Kensington community is really going through over the last 3 years following the Grenfell tragedy. I would like to invite the Select Committee to discuss how this topic should be developed in your ideas, and I would like your views on this. Perhaps some people from current officers would like just to give their views on this issue before we start setting up the working group. Anyone would like to? Can I call into any committee members? I can see Councillor Atkinson, his hand up. Yes, Councillor Atkinson, can you add any input there? Then Councillor Williams. So, Councillor Atkinson, please, since I called on him.
Thank you, Chair. Basically, in the light of sort of the conversations or the things that were said at the council meeting last night, I wanted to put in a word for the importance of the reserve item, Gossa's reserve item, immunisation. Now, all the other topics you've got, I think, are very important and need to be covered. But I think immunisation, if it can be possibly fitted in, would be of great value and use to the committee and the wider community. So I suppose basically I'm putting in for a plug for that, and would ask that the committee finds time to give immunisation the attention that it deserves. Thank you, Chair.
Thank you, Councillor Atkinson. Councillor Williams?
Yes, Chairman. As I previously indicated to you, I'd be happy to take part in the group looking at mental health in North Kensington. I mean, my own view is I think, as Councillor Addenbrook said, in the context of, which I think would be a very important input, the survey. I mean, it will be a challenge carrying it out at the present time. But I think the first thing is to set up a small group, which will then consider the best way forward.
Thank you so much, Councillor Williams.
Anyone else? I'd just like to add one more thing. I think it's very important to have at least one person, one councillor from North Kensington, and Mrs. Hurd can correct me if I'm wrong, but that councillor does not have to be a member of this select committee, I believe.
That's right, councillor. Any backbench councillor can be a member of a scrutiny working group. They don't have to be a member of the committee, but as you've outlined, it's important to try and get members from both parties to the working groups.
Okay. Thank you, Councillor Williams. Now, anybody else want to comment or have an? Because I would like actually to call for a formulation of interest group first, and then between them they can select the chair. And personally, I would like to recommend Councillor Williams to chair the working group for one simple reason. But before elaborating on this, I can see Councillor Idris hands up, so I would like to give her the chance to talk now. Yes, Councillor Idris.
Thank you, Chair. As I indicated earlier, I would like to join Councillor William in his group.
Thank you, Councillor Idris. Yeah. Councillor Addenbrook, please.
Thank you, Chair.
Your question?
One area which I'm particularly interested in is transitions from children to adults, whether it's mental health or people with learning disabilities or disabilities. And I really think it would be a good area for to be scrutinised.
Thank you. In fact, this group, that's why I'm giving it extra attention here, because it's. I had a chat with the chair of the Family and Children Services Committee, and she's interested to have a joint working group, because Councillor Williams, he sits on both committees, on our committee and the Family and Children. And the young adults, as Councillor Addenbrook highlighted, that's a really difficult age, becoming, 17, 18 to 20, 21. And that's not an easy transition for that young adult stage. But we need to look as well on in the general picture, as it is going to be a probing, in-depth analysis. Try to study in depth this issue. So, and that's why I'm recommending the Councillor Williams to lead on this working group, and then between Councillor Williams, Councillor Idris, and other members from the Family and Children to sit on that committee. And I believe Councillor Blakeman, she's interested in that, to join this committee, to this working group. So, so if the committee in agreement, I would like to, that's Councillor Blakeman, she's here. So would you like to come in?
Yes, sorry, I said I would not serve on that group at the Family and Children's meeting.
No, the mental health working group. Councillor Blakeman?
Yes, I said I would not serve on that committee. I wanted to serve on the other committee, but I wasn't allowed to.
Sorry, which committee, Councillor?
Sorry, you weren't at the Family and Children's Services. We were allocated work, and I declined to be allocated.
I do apologize. So, but you won't be interested in the in this group? No.
No, I wanted to go on the other group.
Okay, I do apologize. All right. So, so miscommunication there. Councillor Addenbrook. Your hand's still up.
Apologies.
No problem. Yeah, I thought you want to come in. So I will, Councillor Williams.
Yeah, I just wanted to say, I mean, I think, thank you firstly for Councillor Idris for joining this group, but I think we're outside this meeting, we can pursue the question of other members.
Okay. So, can I open it to the Councillor Blakeman? Yes.
Yeah, Councillor Atkinson wants to go on that group.
Oh, good. Right.
Are you nominating him?
Problem solved.
Atkinson is with us.
Well, he's too shy to nominate himself.
As Judith well knows, the one thing I'm not guilty of is being shy. No, I was waiting to see if actual committee members wish to serve. But as other people are not rushing forward, I would very much like to serve on the Mental Health Working Party. Please.
Okay, thank you very much. So we'll note that, and then Councillor Williams. So between you there, but I would like to nominate, if the committee in agreement, for Councillor Williams to lead this group. Are the member of the committee in agreement with this?
Yes, Chair.
Yes, agreed, Chairman.
Agreed.
Thank you.
Great,
So,
thank you.
Councillor Williams, thank you so much for taking this initiative, and I will welcome your first meeting with your group, and you will inform us of your the terms of reference and what you need, and you have our full support. And thank you so much for being in this addressing this issue of mental health in North Kensington. Thank you. Can I move on to the next topic, which is the primary care provision? This issue here is going to be a single issue meeting where we are going to meet with our residents. We'll hear from them in details. It's going to be relevant to the stakeholders from the NHS partners and council officers. So this meeting I'm proposing to be arranged for Monday, the 22nd of February, 2021, and we'll be focusing on that single topic on the primary care provision. So now I will like to call for the committee to nominate members for this committee. And the issue here, I would like to call Jackie to clarify the role of that, what they are aiming for. I think she did in the early introduction that this working group will be specifically looking at the issues we are going to address in that domain. So, Jackie, do you want to add anything to this explanation?
Yeah, thank you. Yes, I think it would be useful for the members of the committee who were interested in this to consider who they think should be invited to the meeting, including our partners and officers, any information they might want to gather before the meeting. So, for example, with this one, I think it would be important to hear from residents what their experiences are of services, so that the committee are hearing from residents, because that's an important role for scrutiny to do that. So it would be around developing it, and if the committee, as I say, wanted to do any, listen to residents, do any research, probably difficult to meet people at the moment because of the situation that we're in. So I think that's what the members would do, and they would obviously get support from scrutiny team to do that.
All right, thank you, Jackie, for that. So we'll would like just to have one just to lead, and then we can ask for who might be interested in joining that working group. So, Councillor Rossi, yes. Councillor Rossi?
Sorry, I was muted. It's not mentioned in this list here, but Jackie will correct me if I'm wrong. I believe there is a meeting on the 19th of November to discuss the Brompton Hospital. So I just thought that should be mentioned. And Jackie will.
It is in my on my agenda, yeah.
So
yeah, I was going to mention it next.
Okay, sorry.
But thank you so much for your reminder. Yeah, that's correct. I just want to sort out these two first, then I'm going to say the about Brompton Hospital. Yeah, Christine Vickers, Miss Vickers, please.
Sorry, just to say that I would be interested in working with one or two other people on preparing this meeting on the 22nd of February.
Okay, thank you so much. I believe, yes, you will be added to this list. Thank you, Ms. Vickers. Anyone else want to? Councillor Rossi, you want to come in?
No, that's fine. I just thought it wasn't written down, so I'll be quiet now.
No, it's thank you for your reminder. It's always appreciated if we miss anything in this virtual environment. So I hope that this is will Now, there was a mention of immunization as from Councillor Atkinson, and in light of last night's motion as well. I mean, of course, in public health, we encourage that, and it will be addressed in hopefully in the primary care when we discuss the primary care provision. Because we have so much limitation at the moment, we need really to finish the program by May. So we need something which we can achieve in this environment. Councillor Addenbrook have an input there.
Well, just on immunisations, we had asked the NHS to come to a Health and Wellbeing Board in November, but they have said due to the increasing COVID rates, they can't come. So that's being pushed back. So we could share their report when we get it in the new year, if that's helpful.
Yes, it will be helpful. Yeah, thank you. Because this will put some comfort. And I've seen some really good publication regarding reaching to those who are hesitant. So I think there is a quite good communication coming out of the council, which I saw one today, very encouraging, reaching out to people who have a great concern, or maybe to reassure them about the vaccination, which was very encouraging. So hopefully there will be more uptake and there will be less pressure on the NHS hospital beds. So if there is no more to add to this on the primary care, at least we have Christine, she's a member there, and I will reach out to another committee member, those who are not here with us today. Hopefully they can be a member of this working group. But thank you so much for accepting this role in this challenging time. And the final things is regarding the special meeting for Councillor Healy. You want to come on this issue of the primary care?
No, I was wondering if you were straying into item 3.7 on page 4, the special meeting on 19th of November about the Brompton.
Yeah, this is about the merger for Brompton Hospital. That will be addressed.
Take place, of course.
Sorry?
We hope that the merger is not going to take place.
Well, that will be. We are going to discuss.
What I want to ask is what the purpose of that meeting is going to be.
We are going to review the health impact for residents and patients on this merger between the two trusts. So that will be a full discussion, because we had a unanimous decision in the council, full commitment that we need to have more information, and we are not in favor of this merger. So that will be a special meeting to specifically discuss this issue from all perspectives.
And will Guys and Thomases be there as well as the people at Brompton and Harefield?
Yes, we are going to invite every stakeholder to that meeting. Yeah.
Including patients and their families?
Residents and patients, yeah. Every stakeholder will try to reach out to and to have a full discussion on this. So this is what I believe is going to be, but we'll sort out the agenda.
Yeah, okay, thank you.
Yeah, thanks for the clarification. I think Councillor Addenbrook, you want to come in here on this?
Yes, sorry, Chair. Just to check, are you going to invite Chell West, the Royal Marsden and Imperial as well?
I will be discussing it with our
I think
our supporting officer.
Rowan, I think Jackie wants to come in here.
Yes, I just saw her hand up. Yeah.
Sorry,
Jackie,
Chair.
do you want to come in?
Yeah, I thought it might be useful if I updated the committee on the things that you'd asked us to do so far to prepare for the meeting. So we've met with Councillor Nagy as chair, and we've agreed it will be a special meeting of the committee, that the Brompton will be invited to give a presentation on their proposal for the merger. Other invitees who have accepted are NHS England, Chelsea and Westminster Hospital, the West London CCG, Imperial College Healthcare NHS Trust, Imperial College London Faculty of Medicine, and the Royal Marsden. So we've secured acceptances. Excuse me, we've secured acceptances from all of those organisations to come to the meeting. So we're still working on it at the moment.
Yeah, and we'll provide a further update to the committee members, and also we'll be publicizing. But I will make it as widely as possible, because we try to resist in every possible way for that icon to be removed or be marginalized from our borough. So yeah, we'll do that. And Councillor Atkinson, please.
Thank you, Chair. I think you've just said what I was going to emphasise. I think it's very important that we encourage attendance by ordinary users, because what we don't want is a comfortable conversation between various established parties who have actually gone along and have already agreed this. So I think that it really is only just, when is it, the 19th, where it's 3 weeks, three and a half weeks. And I think in that time, in order for it to be truly representative of what the community believes, some effort needs to be put into informing ordinary residents of this important meeting.
Thank you, Councillor Atkinson. Yes, I agree. And this is following on from Councillor Healy, involving patients and residents, and how important to continue with the Royal Brompton in our borough. Thank you.
Councillor Rossi here. I was just wondering, Jackie, if we could get it on the website, council website, about the meeting.
Yes, we're working with our colleagues in communications, so it's in the calendar, but I know that's not where most people would look for a meeting. We need to do other promotion of the meeting. We were just waiting to get the acceptance from the Brompton in particular that they were going to come to the meeting before we promoted it more widely. So yes, we'll put something on the website and in a place that somebody would look that doesn't want to specifically look for a meeting, but they are interested in the issue, and we look for other ways to promote it. So yes, thank you for those suggestions.
Yeah, this is on Brompton. Hopefully we can all play our parts as well with our constituents to encourage wider participation. So I conclude here, and hopefully we'll have that meeting soon, next month. May I move now to item A7? Any other oral or written items which we might see, do you think is important? So can I ask the committee members please to contribute here? Or officers, in the light of COVID, we missed out during this conversation. You want to add or add value to it, making us aware of it, so we can address.
Chairman, if you could give me a couple of minutes.
Of course, Councillor Spalding, please.
Okay, I did declare at the beginning it would be a ward-related issue, but it may have ramifications borough-wide, and that it is directly related.
Councillor Spalding, sorry,
yes, can you hear me?
Yeah, can I just stop? Councillor Atkinson, I just saw your hand before, Councillor Spalding. Are you following up on any question, or
No,
can I
I'm
continue
sorry.
with-
I should really just stop using this electronic hand. I do apologize.
No, please do use it. We appreciate visual as well as verbal. We don't want to miss anyone out. So yes, Councillor Spalding, I do apologize, interrupted you there. So please feel free to talk now. Thanks.
Thank you, Chairman. I have taken my hand down already.
Okay.
Of ending in about 3 minutes. I hope if you can indulge me for 3 minutes.
Please do.
I want to set the scene. This has come really to become very obvious during lockdown. And it's something I hadn't quite realised before, that nobody's taken a long-term view of this. My ward, Earls Court, has got 50% of the borough's severe support needs housing. And of course, we want to help people who have mental illnesses. I mean, they have my full sympathy. And when I was worked in education, I had lots of students who had mental health problems. And of course, we looked after them. And we want to get them on a road to recovery and rehabilitation. But historically, the Earls Court ward has got not just all that severe support needs housing, but we've inherited a lot of very rundown and cheap private accommodation. And of course, we've got 5,000 hotel beds, which are very cheap rundown hotels in the main. And they're not being used because we've lost our main business, the exhibition centre. So that means we have this perfect storm of circumstances where not only have all the homeless of this borough, but homeless from lots of other boroughs have all come into Earls Court because there's cheap housing and spare capacity in hotels. And then even now the Home Office is putting in all the waves of illegal migrants are coming to Earls Court. So we're carrying a very big burden of people who need help. But of course, within that burden, within the spectrum, we're getting what I'd call the extreme ends. So we've got lots of vulnerable people who we look after in Earls Court, but we're getting some rather extreme placements. A lot of people who are extremely mentally ill, who I would call patients, very often related to drug addiction and alcohol. Now, if you wanted to take those extremely mentally ill people and you wanted them on a pathway to recovery and to happiness and to being functioning, which they want and we want, you wouldn't choose the situation we've got, which is to put them into the most densely populated ward with 5,000 potentially tourists to beg from, and also with 24-hour open off licenses, and of course good transport links for all the drug dealers who come here. So what we're doing is putting these people into a situation where we're actually sustaining their illness and their addiction habits, and we're not actually doing anything to help them. And it's quite unfair on them, but it's also very unfair on the vulnerable people that we do house in Earls Court, because we're getting very inappropriate placements of extremely ill and also people out of prison into normal social housing. And I've got lots of vulnerable residents in normal social housing, and their lives are being devastated. If I showed you my inbox, like me, you would weep to see the awful situations that some of our vulnerable residents are being put through. Now, there is a thing called a councillor call for action, and it's on the last page 6 of our pack this evening. And if the ward, and all the ward councillors are with me on this, Earls Court, there are 3 of us, we can filter out cases for you. We can talk about how the operational day-to-day business is going slightly wrong. We can take a long view, and with your permission, Chairman, we would like to write a report for you, which you might find a gap for on a future agenda. And this report would come to you, and we might give you some recommendations which this committee could look at And Chairman, if you so decided, you might just think that these recommendations could be taken further. So that's my call for action as a ward councillor. Thank you, Chairman.
Thank you so much. Thank you, Councillor Spalding, for sharing this. It is an issue with multiple departments, multiple stakeholders, but I can see it is something this committee as well can look at. So if you want to lead on this, I can put it to the committee as well, and you are a member of this committee, is to agree this course of action, and I'm happy to support it because it involves some of the issues we are addressing, especially mental health. People going into the community, they are not really well supported, as I can see from your input there. So if the committee is happy with this, I'm really happy to accept that recommendation. So can I ask other members of the committee, please?
Chairman, my only thought would be, because I think some of these issues impact on my ward as well, is that because, I mean, it is cuts across a number of different sort of directorates and policy areas, whether should the report go to the Overview and Scrutiny Committee?
I think, well, because it's been proposed by Councillor Spalding, he would like to pass it on to this committee for later on, and then we can move it to the Overview Scrutiny Committee. I would like to see other committee members' view on that. Thanks, Councillor Williams. Yeah. Other members, please, can you comment before I open to Councillor Mason? He is with us to ask a question. But first, member of the committee, do you want anyone to comment on Councillor Spalding's statement? So, can I ask Councillor Mason to comment, please?
Thank you.
Or ask question.
Thank you, Chair. On the issue that Councillor Spalding just mentioned, of course, I recognise the issue that he describes in with regard to Earls Court. But of course, these issues don't just pertain to Earls Court, and we can go across the borough, certainly across North Kensington, certainly into my ward. If you look at the NHS statistics, I think without exception for the last couple of decades, it tells you the high levels of mental health issues that there are amongst our population for all sorts of socioeconomic reasons. And in Goulburn Ward, where I am a councillor, we have a plethora of people with mental health problems that morphs into drug problems, and their houses getting used by drug dealers as drug dens, etc. So this, really what I'm saying is that this is, whilst it's a serious problem in Earls Court, and I understand that because I've been around a long time, it's not an issue that's distinct to Earls Court. It covers probably most of North Kensington, probably quite a few areas of the south as well. So so obviously it'd be useful if it was looked at wider in a wider context, because otherwise we will empty Earls Court into other areas of the borough if that was the intention, to move people to different places. There's a whole plethora of problems: tenancies, support, as you said, for people with mental health problems, of which there probably isn't, and particularly during COVID, it's much worse now during COVID because a lot of officers are working from home, and there's a less and less support for the people who actually need it. So all of our caseload is rising. So it's an issue that spans many areas of the borough, I would suggest. I don't know if it can be widened out or not, if there is a group on this, but it's not just an issue pertinent to Earls Court. But as I said, I recognise that it is a serious issue there.
Okay, thank you, Councillor Mason. I will give the floor to Councillor Idris, then Councillor Spalding, then Councillor Shuhan. Councillor Idris, please.
Thank you, Chair. I think the situation that Malcolm has described is very is multi-layered, and it is on the surface of it, it might seem to be a health issue, but I think there is a lot more to it than health, and I think it will not get the attention it really deserves if it's just looked at on one, if we looked at one aspect of it. So I don't know exactly where it will fit best, but I think maybe the overview will be able to look at it in more depth and maybe dissect part of it and give it to the relevant select committees to actually look at different aspects of it. That's my take. Thank you.
Okay, thank you, Councillor Idris. Councillor Shohan, then Councillor Spalding to finish off. Then I will make my final comment. Okay, Councillor Spalding.
Thank you, Chairman. Of course, Councillor Mason is absolutely right. And that was part of my preface, really. I did say it was potentially a wider problem across the whole borough. And of course, the Council Call for Action does say, generally, this is an operational focus, which is why I've dealt with it under this mechanism. But it will have some strategic elements. And of course, this committee and you, Chairman, and Councillor Williams are actually addressing this strategic issue of mental health in the whole of North Kensington. And so I think, you know, our findings, you know, can actually support maybe the work of that working group. But Councillor Idris is quite correct. In Earls Court, it's a big overlap between what housing does in their silos and making nominations into the wrong kind of housing in the wrong places for the wrong people, and how that overlaps with adult social care and health, and especially mental health. And of course, these two silos of social care and housing, it's in the overlap, and it's very often where the problem emerges, because not only are the departments in silos, as Councillor Mason correctly pointed out again, the officers are working at home. And so even within departments, officers are becoming more siloed. And it's our job as councillors actually to take the overview and the strategic view and try and identify where there are issues and problems which we can help with. And my residents are crying out for these problems to be solved. So I do support Councillor Williams in his work in North Kensington, but I feel that Earls Court certainly deserves at least a report to come to you, Chairman, on the table when we've done our due diligence and done the work and done the research, and bring that to you, Chairman, to decide what to do with our reports. So I'm in your hands entirely.
Thank you, Councillor Spalding. I've seen some of the elements as well on adult social care and the addressing the health issue in general. Since you reached out to us and we are part of the overview scrutiny structure, I can't see any reason why your colleagues can conduct this exploration, and you can bring us your report, since we are having a working group for the whole area in depth study for North Kensington. So this will add value, and I really recommend and support you on this initiative, because it will complement as well the work we are doing in the North at the same time. So yeah, and hopefully you and your colleague, you will have our full support in this initiative, because I cannot see it as a really separate from what we are trying to address in North Kensington as well. And they're having more dimension to it as well, as you outlined to me in our conversation in Earls Court. So you have my full support there, Councillor Spalding. So hopefully go and you have our blessing into that work.
Thank you, Chairman.
Yeah. Thank you so much for bringing us this issue, which it's not easy. Councillor Mason, I can still see your hand up. Do you want to comment further, or it was just?
No, I forgot to. I forgot to put my hand down, Chairman.
I need to conclude now. So, I would like to, yes. Yeah, thank you so much, Councillor Mason, for your input there and finalizing this issue here. So this will bring me up to the conclusion of our meeting tonight. It's 2023. And I'm really grateful to to everyone who participated in this discussion, to our officers who staying with us up to this evening. And I wish you a very good night and a very pleasant weekend. Thank you so much. I will conclude the meeting now.
Thank you, Chairman, for a good meeting.